IJN and always keep your social distancing. Your cooperation is highly appreciated. Thank you. Announcing the arrival of Yang Berbahagia Tan Sri Datuk Dr. Nur Hisham bin Abdullah, Director General of Health Malaysia, accompanied by Yang Berbahagia Datuk Dr. Abdul Rozali bin Awad Tut, Chairman of Institut Jantung Negara, IJN, Yang Berbahagia Profesor Datuk Dr. Hassan Basri bin Awang Makdahan, Vice Chancellor UniSZA, honoured guests from UniSZA and IJN. Ladies and gentlemen, please rise for our national anthem. Ladies and gentlemen, please be seated. Assalamualaikum warahmatullahi wabarakatuh and good afternoon. Yang Berbahagia Tan Sri Datuk Dr. Nur Hisham bin Abdullah, Director General of Health Malaysia, Yang Berbahagia Datuk Dr. Rozali bin Watut, Chairman Board of Directors IJN, Yang Berbahagia Profesor Datuk Dr. Hassan Basri bin Awang Makdahan, Vice Chancellor UniSZA, Yang Berbahagia Encik Muhammad Ali bin Ghazali, Board of Directors UniSZA, Yang Berbahagia Datuk Dr. Aizai Azan bin Abdul Rahim, Chief Executive Officer IJN, Board of Directors of UniSZA and UniSZA Holdings, delegations from University Sultan Zainal Abidin UniSZA and UniSZA Holdings, delegations from Institut Jantung Negara IJN, friends from the media, and ladies and gentlemen. Welcome to the Memorandum of Understanding signing ceremony between UniSZA and IJN. Praise be to Allah subhanahu wa ta'ala for the blessings that we are gathered here to witness this historical event. We are honored to have the presence of Director General of Health Malaysia Yang Berbahagia Tan Sri Datuk Dr. Nur Hisham, delegation of UniSZA and IJN with us here today. The objectives of this MoU are to conduct research in medical and healthcare and to provide teachings and trainings of medical practitioners in healthcare. Distinguished guests, ladies and gentlemen, without further ado, I would like to call upon Yang Berusaha, Mr. Ahmad Tirmizi bin Ghani, to recite the dua. Please welcome.
Al-Fatiha. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Ya Allah, Ya Rahim. Praise be to God, the Lord of the worlds. Peace and blessings be upon our Prophet Muhammad sallallahu alaihi wasallam and his companions, and for those who followed his example till the judgment day. Allahumma ya Allah, on this blessed day, in conjunction with the Memorandum of Understanding signing ceremony between University Sultan Zainal Abidin UniSZA and Institut Jantung Negara IJN, we beseech Thee and are grateful towards You in favor of all the infinite blessings given to us, Your humble servant, to live a safe and prosperous life. We seek Your blessing for a flawless progress of this event from the beginning till the end. We seek Your guidance to steer clear of events that would be detrimental to the progress of this ceremony. Ya Latif, Ya Rahman, please bless us with Your taufiq and hidayat. Please guide UniSZA and IJN to greatness, peace, glory, and prosperity in this world and the hereafter. Make us responsible intellectuals. Grant us valuable knowledge that will be beneficial to mankind in order to gain Your mardatillah. Make us Your righteous servant that follows Your commands and neglects sinful acts. Please forgive us for our wrongdoing. Ya Munzil al-Barakat, bestow peace on our beloved country, Malaysia. Preserve us from any threat and disaster, neither man-made nor natural disaster. And to You, Ya Allah, we ask for security and prosperity upon us, our leaders, and our country. Bestow patience in us in order to face the challenges from You. Please accept our deeds and please reward us accordingly. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzaban nar. Wa sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wa sallam. Walhamdulillahi rabbil alamin.
Thank you to Mr. Ahmad Tirmizi for the dua. Ladies and gentlemen, to start off our ceremony, we would like to invite Yang Berbahagia Professor Dato' Dr. Hassan Basri bin Awang Makdahan, Vice Chancellor UniSZA, for his speech. Please welcome.
Thank you sahabat acara majlis. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Yang berbahagia Tan Sri Dr. Nur Hisham bin Abdullah, Director General of Health Malaysia. Yang berbahagia Datuk Dr. Abdul Razali bin Watooth, Chairman Board of Directors IJN. Yang berbahagia Encik Muhammad Ali bin Ghazali, on behalf of the Chairman of Board of Directors UniSZA. Yang berbahagia Dr. Aizai Azan bin Abdul Rahim, Chief Executive Officer IJN, Board of Directors of UniSZA and UniSZA Holdings, delegation from University of Sultan Zainal Abidin and UniSZA Holdings, delegation from IJN, friends from the media, ladies and gentlemen. Alhamdulillah, and thanks to Allah subhanahu wa ta'ala for his blessing today to witness the MOU signing between University Sultan Zainal Abidin UniSZA and Institut Jantung Negara IJN. It is with our greatest gratitude to have Yang Bahagia Tan Sri Datuk Dr. Nur Hisham bin Abdullah, the Director General of Health Ministry of Malaysia, with us today, knowing that you are very busy, Tan Sri. The signing ceremony is not the first step for collaboration between UniSZA and IJN. It is the push factor after several visits, discussion and meeting being held since 2020. Inshallah, with this MOU signing ceremony, we believe it will open more opportunities for both parties to explore more on the business venture that will be championed through our holdings company. This event is not limited to business collaboration, but will benefit both parties on the technologies and knowledge on the field of cardiology especially. With the signing of this MOU, more opportunities for cooperation can be explored between both parties. Among the opportunities that need to be seized are: number one, knowledge transfer in the development of teaching and learning program, especially from IJN. Research in development and technologies in cardiology within Malaysia and could be expanding through Asia and internationally. Number three, opportunities for expertise from UniSZA for being attached to IJN and learn from the top expertise available in IJN. Number four, successor plan for UniSZA to produce top surgeon in the cardiology. I believe for IJN is the opportunity to expand their wings in East Coast region. With establishment of IJN in Terengganu, it will benefit to the population of residents in Kelantan and Northern Pahang that need the service from IJN with the shortened travelling time. Besides that, with the signing ceremony, it will boost up the business opportunities and economic activities for local people. I would also like to take this opportunity to record my appreciation and special thanks to the holding board's members, management team, and from the IJN that have worked towards the implementation of a memorandum of understanding today. Congratulations. Hopefully there are many more programs that further strengthen the relationship between UniSZA and IJN. Finally, I sincerely hope that the signing of this MOU will boost the existing areas of cooperation between UniSZA and IJN, as well as generate new areas of cooperation that provide impact and benefit for both parties. For your information, Tan Sri, we just had initial meeting this morning prior to our MOU signing today. So thank you once again. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Yang Berbahagia Datuk, for your speech. Now we would like to invite Yang Berbahagia Datuk Dr. Aizai Azan bin Abdul Rahim, Chief Executive Officer from IJN, for his speech. Please welcome.
Thank you very much, Madam Chairperson. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very warm welcome to everyone. I would like to start by stating our utmost gratitude to our partner, University Sultan Zainal Abidin, or better known as UniSZA, in this milestone joint initiative with IJN to set up a heart specialist center in its soon-to-be open university hospital. IJN indeed is very honored to be your partner in this journey of improving access to high quality healthcare, specifically in cardiovascular and cardiothoracic care. Ladies and gentlemen, the signing of the MoU today between IJN and UniSZA is a partnership that will see IJN, the leading heart institution in the region, providing our expertise in cardiovascular and thoracic care to the upcoming UniSZA Teaching Hospital located in Gong Badak. This will involve providing our specialists to the new hospital with heart care services, as well as sharing their skills and exploring possibilities of joint research initiatives. It is no secret that IJN is at the heart of cardiac care in Malaysia. Since our inception, we have been delivering leading-edge and high-quality heart care and treatment to Malaysians. As of 2020, we have served almost 5 million Malaysians from all walks of life from all over the country. We have also established a strong international reputation and recognition, and we are accredited with the Joint Commission International, which is a US-based organization, since 2009, and also locally by MSQH, which is the Malaysian Society of Quality in Healthcare, since 2006. Building upon our successes so far, a core part of our current strategic plan is to expand our services and expertise beyond the confines of our current headquarters located in Jalan Tun Razak in Kuala Lumpur. Our goal here is to widen the accessibility of our quality medical services, as well as to encourage greater knowledge transfer of our cardiovascular and thoracic expertise. By cooperating with like-minded organizations such as UniSZA, we can make this vision a reality, inshallah. We plan to provide full cardiac screening and testing, cardiac diagnostic investigations, treatment of cardiovascular and thoracic diseases, as well as emergency treatment for heart attacks and heart failure. IJN will also be engaging in the training of medical practitioners and allied health staff. In addition to this, we hope to work with academic talents within UniSZA itself to expand our current roster of research programs, inshallah. Ladies and gentlemen, IJN's desire for collaboration is inspired by our ambition to keep pushing the standards of innovation and quality in our services. One of our current initiatives is to expand our integrated and multidisciplinary team approach to heart disease treatment and care, and this is crucial because we are now seeing increasing rates of comorbidity with cardiovascular disease such as diabetes, hypertension, as well as kidney failure. According to the recent 2019 National Health and Mobility Survey, around 2/3 of the Malaysian population have at least one of 3 non-communicable disease, namely diabetes, hypertension, or hyperlipidemia, and more than a quarter have at least 2 NCDs or non-communicable disease, and almost 10% have all 3. So indeed, this is a very high-risk population. So these dire numbers have inspired us to pursue the establishment of an integrated disease management center, and this will build upon IJN's existing all-rounded holistic approach to cardiovascular care by providing ancillary services to support heart patients and their other comorbidities. As the UniSZA Teaching Hospital plans to be a state-of-the-art research center for chronic diseases in the country, we hope that we will be able to further collaborate on this front as well. I hope that this partnership will be the start of other future collaborations between IJN and UniSZA in the field of healthcare services. I believe with our vision, as well as our combined strengths and expertise, there will be even more opportunities for us to embark together to provide better heart care services to the East Coast region. Once again, we'd like to thank everyone here, and I look forward for us working together in our efforts of enhancing the quality of healthcare in Malaysia. Thank you everyone, especially to Tan Sri DG for making time from his busy schedule to witness this historic MOU this afternoon. And I wish Tan Sri and all of you stay safe always and have a very good day ahead. Thank you so much.
Thank you to Yang Berbahagia Datuk for the speech, and Yang Berbahagia Datuk, please remain on the stage for the next event. We have arrived at the highlight for the day, which is the MOU signing ceremony. With that, we would like to invite from UniSZA Yang Berbahagia Profesor Dato Dr. Hassan Basri bin Awang Makdahan, UniSZA Vice Chancellor, accompanied by Encik Ismail bin Musa, UniSZA Registrar. And from IJN is Yang Berbahagia Dato Dr. Aizai Azan bin Abdul Rahim, CEO of IJN, and Yang Berusaha Dr. Hasri bin Samiun, Chief Clinical Officer, IJN. And Yang Berbahagia Tan Sri Dato Dr. Nur Hisham bin Abdullah, Director General of Health Malaysia, accompanied by Yang Berbahagia Dr. Abdul Razali, Chairman, Board of Directors, IJN, and Yang Berbahagia Encik Muhammad Ali, Board of Directors, UniSZA. To our fellow media, please be advised to always follow our SOP, always wear your mask, and make sure that social distancing is always being kept. Thank you. Please be seated. Thank you to our distinguished guests. We are honored to present a token of appreciation to the Director General of Health Malaysia, Chairman Board of Directors IJN, and to the CEO of IJN. Some of the token consists of book title Mendepani COVID-19, published by penerbit UniSZA, and a box of chocolate made by Faculty of Bioresources and Food Industry UniSZA. IJN has also prepared a token of appreciation to the directors of UniSZA and to the Vice Chancellor of UniSZA. Ladies and gentlemen, our ceremony has come to an end. Once again, thank you for gracing our signing ceremony with your presence. We invite our distinguished guests for a press conference, and we would like to invite other guests for lunch located next to this hall. Thank you. Assalamualaikum warahmatullahi wabarakatuh. To our fellow media friends, please be advised to always follow the SOP, always wear your masks, your face shield provided by IJN, and always keep your social distancing. Your cooperation is highly appreciated. Thank you.
Tes, suara 1, 2, 3. Tes, mic 1, 2, 3. Tes. Tes 1, 2, 3.
Hi, Nora from NHT. Can we find out more for this center at the hospital pengajar ni? What does it entail? The facility macam mana? Is it a new center within the hospital ke macam mana? Among the collaboration.
Yes. I think, UniSZA is setting up its own teaching hospital, and it will be, inshallah, yes, operational very soon by first quarter of 2022. Yes. Okay. Pakai mask, ya. Alright. So as part of the collaboration, IJN has been located in Kuala Lumpur since 1992. Yeah. Yet we are seeing patients from all over the country. Yeah. And there's also a number of patients that are coming from the East Coast states. From our statistics, we have about 30,000 patients coming from the East Coast states. Yeah? And one way for us to improve the accessibility of patients to quality healthcare is, instead of patients coming to us, why don't we bring the services closer, closer to the patients. So that will hopefully increase the number of patients who have access to quality cardiac healthcare within the comfort of their own state Yeah, so some distance is a major issue for some of our patients. Yeah, so bringing the services closer to the patients, I think, is one way of enhancing cardiac care, and we are very delighted with the partnership that we are going to have with UniSZA, as they have a brand new hospital that is going to be opening up very soon. Yeah, and we have been involved in discussions so that we can provide not just in terms of the medical care of the patients, but as well as providing training opportunities for the doctors, the medical students there, the paramedical staff there as well, and also to provide research initiatives as well with our partner UniSZA.
Untuk kali pertama tu, IJN keluar daripada Samsung.
Yes, in fact this is in sense historical lah, ya. Kita tak pernah ya beroperasi di luar IJN di Semenanjung, ya. So it's the first time kita buat.
So do you have future plans in other areas or with other universities following this?
Yes, of course. I think as in any organisation, because as I said, we have patients from all over the country, and requests that we had in hospital from many of our patients who don't come from KL is that why don't IJN open up new clinics or new hospitals in other parts of the country. So part of our desire to do that is also to fulfill some of the requests from our own patients. Yeah? So UniSZA, we chose UniSZA mainly because we think that UniSZA has the qualities that best complement IJN's needs. Yeah? In that they are relatively young, macam IJN juga, young, and they have got a dynamic teaching faculty as well. Yeah? So I think it is always nice to start in a new area with a new university. Yeah? That's the reason why we want to partner up with UniSZA. Yeah? And also we have very strong support from the Vice Chancellor of UniSZA as well as from his academic staff there as well. Yeah? So I think it's multiple factors why we chose to partner with UniSZA.
So the center will provide full facilities that are available in HQ, also in Terengganu soon?
Eventually, because we are starting off first small, and then as we build up capacity, because as you know, even for IJN, it took us many years to build up our capabilities and capacities. So we envision that also our collaboration with UniSZA will also be over a time frame. Yeah? But ideally, that is what we have in mind, so that we offer full services as what is available in IJN to East Coast states, and where UniSZA is located in Terengganu.
Can we find out the cost for the project?
The cost for the project, I think I have to hand over to my partner here, Professor Hassan.
Yeah. Normally in the current practice in the government, we use the budget that currently using. It's no extra cost for the project. No extra cost. Okay. Because we have logistically we have the hospital, and IJN come at the right time to work with the UniSZA, especially with the hospital.
Currently, UniSZA, how many students in the medical faculty?
Medical faculty, how many students?
Yes.
For year 1 year we have 60 students. So altogether, about 300 students.
Sorry?
300 students.
300.
Yeah.
So for this collaboration will be,
How many will be?
yeah.
For this collaboration,
How many
actually, yeah, it is a big opportunity for UniSZA to collaborate with IJN, because it is a good opportunity for students to learn and to be trained under cardiologists and experts from IJN, and as well the lecturer as well. We have expertise in cardiology, but not at the number like IJN has.
I think if I can add, as you know, cardiovascular disease is still the major killer in Malaysia. If you look at it, statistically speaking, about at least a quarter, 25% of certifiable deaths are related to cardiovascular disease, and mainly because many of the common risk factors are very common in our country, like diabetes, hypertension, hypercholesterolemia. Yeah? So for us, it's an opportunity for us to try and make a difference. Yeah? In the past, we always thought that cardiovascular disease is only located in major cities. Yeah? But if you look at the trend, that's not so. Even in the kampungs and villages, yeah, heart disease is also becoming a major cause of mortality and morbidity, because there's a rising prevalence of unhealthy diseases such as high cholesterol, diabetes, obesity, and hypertension. Yeah? So it is a great way for us to collaborate with UniSZA on that aspect, because they've got a very strong research arm in the university. Yeah? And I think research is important for us to localize our therapeutic strategies for the long term.
Do you have specific research you have in mind, or to start with the?
So I think we will have further discussions with UniSZA, because as you correctly pointed out, there are so many areas of research. Yeah? So we will need to prioritize and localize what is most suitable within the context of Terengganu. So commonly, I think we still need the basic data about the disease patterns, prevalence of certain diseases, what is it and why is it because we need to know what are the risk factors are more prevalent, and then only we can formulate interventions in trying to reduce that problem. Yeah. So I think it's still a work in progress, which we will discuss further with our colleagues in UniSZA and the lecturers there.
Yeah, and in addition, research is a core business of the university, so it's not new for us. But when IJN comes, so it strengthens the research.
Do you have existing or current ongoing research that?
Definitely, yeah. Because we already have faculty of medicine since 2012. Yeah, it's not young. So we have professors in cardiology, professor in another area. So by having the IJN as our collaborator, it will strengthen the research in the university, especially for the faculty of medicine. Sorry?
Any specific research or interesting research you want?
As Datuk mentioned just now, some are already done now, but some will be our future area that we will explore. I think this is common. It is common, whether you are in the East Coast or West Coast, everywhere.
As for IJN, how many staff did you recruit? For Terengganu?
So I think we will start small first, because the hospital is still not fully completed. So we'll start with just basic specialist outpatient services involving adult cardiology, and as time goes on and the capacity is greater and the building is also more operational, then we'll add other services including pediatric cardiology, cardiothoracic services, and also thoracic services. So this would be this is core IJN business, but at the same time, we also want to develop together with UniSZA. We call it this integrated disease management, because most of the time, sakit jantung, heart disease doesn't exist in isolation. There's always the risk factors that cause heart disease. So we want to collaborate with them to look into specific diabetic clinics, hypertension clinics. So these things will develop as we go along this journey together with UniSZA.
Thank you.
Alright, thank you so much.
Sama ni nak cuba.
Ini sekejap Ni dah tunggu. Pun tak buat banyak my last card I think.
Was that your last card?
One more. Okay, last one. Last one. Nanti you kongsi lah.
Baiklah. Terima kasih. Thank you, Dato'.
You're finishing my card. Dah cukup ya?
Kemudian Datuk, bila jangkaan